नहमदुहु व नस्तली अला रसूलिहिल करीम अम्मा बाद व अऊज़ु बिल्लाहि मिनश शैतानिर रजीम बिस्मिल्लाहिर रहमानिर रहीम. Today's topic of discussion is estimating the potential for prevention. I am Dr. Fatma Jalal Chaudhary. I am PGR MPhil here at with KAMU with you. I'm going to present the same topic under the very kind supervision of Professor Dr. Sara Afzal, who is Dean IPH Lahore. Now, as we say, the quote of the day for today is the way to get started is to quit talking and begin doing. What is the layout for today's presentation is introduction to our topic, important terms and parameters defined therein, epidemiological sequence followed, statistical parameters defined and explained to some extent, artificial intelligence test of significance and implications in prevention potential, recent updates, MCQ session and key takeaways, and note of thanks to all of you. What are the objectives? At the end of the presentation, the audience should at least be able to identify the major terms used in prevention potential, its implications and basic models, key integrations, and recent advances. So, as for the epidemiology, sequence is related. How do the experts define it? Preventive interventions can be defined as the deliberate changes in the prevalence of risk factors in a population. Why is it being done, or why is a need being arising there? To be able to weigh the costs and the benefits of such preventive interventions if done, an estimate will have to be made of their effects on the health of the population on which this intervention is applied. So, navigating the future's predictive analytics or predictive AI encompasses a variety of statistical techniques from data mining, predictive modeling, and machine learning that analyzes the current and historical facts to make predictions about future or otherwise unknown events. An estimate of the changes in the health status of the population as a result of these shifts in the risk factor prevalence will be important for the planning of the health services and for the setting of the realistic tasks as proposed by WHO. So, Prevent is a tool that will estimate the health effects of changes in risk factor prevalence in a population as a result of trends or interventions. Its results can either be used directly in health policy making to formulate targets or quantify different scenarios on changes in risk factor prevalence in the future. So, a bit of the explanation for our defined parameters. It's in epidemiology and analysis of the distribution of disease incidence and risk factor prevalence in different population is used to confirm the hypothesis of a causal relationship between the risk factors and the diseases. Its results can be used as an input for the formal decision making processes such as, for instance, cost, effectiveness studies, etc. So, different parameters for estimating the potential for prevention. The strength of the relationship is often expressed as the ratio of incidence between exposed and non-exposed, which is known as the incidence density ratio, which is IDR. The importance of a risk factor for the incidence of a certain disease in a population is usually expressed as the etiologic factor, which is EF, the proportion of the total incidence of the disease that can be attributed to the prevalence of that risk factor in the population. So, what are the degrees of models or assumptions as defined by the epidemiologist? Statisticians distinguish between three levels of modeling assumptions in the prevention potential: fully parametric, the probability distributions which are describing the data generation processes are assumed to be fully described by a family of probability distributions involving only a finite number of unknown parameters. For example, one may assume that the distribution of population values is truly normal with unknown mean and variance, and that datasets are generated by simple random sampling. And the family of generalized linear models is a widely used and flexible class of parametric models. In the upcoming slides, we'll be dealing with the generalized linear models in an more detailed way. So, non-parametric methods, the assumptions made about the process generating the data are much less than in parametric statistics and may be minimal. For example, every continuous probability distribution has a median, which may be estimated using the sample median or the Hodges-Lehmann estimator, which has good properties when the data arises from the simple random. So semi-parametric tests, this term typically implies assumptions in between the fully and non-parametric approaches. For example, one may assume that a population distribution has a finite mean. Furthermore, one may assume that the mean response level in the population depends in a truly linear manner on some covariates, a parametric assumption, but not make any parametric assumption describing the variance around that mean. That is, about the presence or possible form of any heterostaticity. More generally, semi-parametric models can often be separated into structural and random variation components. One component is treated parametrically and the other non-parametrically. The well-known Cox model is a set of semi-parametric assumptions. So predictive models in statistical analysis, predictive models basically exploit the patterns found in historical and transactional data to identify risks and opportunities. Models capture relationships among many factors to allow the assessment of the potential association with a particular set of conditions, guiding decision making for candidate risk factors or transactions as in and the business model. So, what is the predictive analytics or predictive AI? The defining functional effect of these technical approaches is that predictive analytics or predictive score, which is the probability for each individual customer, employee, or healthcare patient, product, SKU, vehicle component, machine, or other organizational unit, in order to determine, inform, or influence the organizational processes that pertain across large numbers of individuals, such as in marketing, credit risk estimate or assessment, fraud detections, manufacturing, the healthcare strategies, and government operations, including the law and enforcement agencies. So all of these models are basically related with the potential for the risk estimation or preventive measures to be applied. So, what is the definition? Predictive analytics is a set of business intelligence technologies that uncovers the relationships and patterns within large volumes of data that can be used to predict behavior and events. Unlike other BI or business intelligence technologies, predictive analytics is forward looking, using past events to anticipate the future. So predictive analytics statistical techniques include data modeling, machine learning, AI, deep learning algorithms, and data mining. Predictive analytics is often defined as predicting at a more detailed level of granularity, that is generating predictive scores, probabilities for each individual organizational elements. This distinguishes it from forecasting, for example, predictive analytics technology that learns from experience or data to predict the future behavior of individuals in order to drive better decisions. The core of the predictive analytics relies on capturing relationship between explanatory variables and the predictive variables from past occurrences and exploiting them to predict the unknown outcome. It is important to note, however, that the accuracy and usability of results will depend greatly on the level of data analysis and the quality of assumption. So, what are the analytical techniques used here so far? The approaches and techniques used to conduct predictive analytics can broadly be grouped into regression techniques or machine learning techniques. So, what are the machine learning techniques? Machine learning can be defined as the ability of the machine to mimic the human behavior that requires intelligence. This is accomplished through artificial intelligence, algorithms, and models. So autoregressive integrated moving average or ARIMA, these models use autoregression, which means the model can be fitted with a regression software that will use machine learning to do most of the regression analysis and smoothing. Time series models are subset of machine learnings that utilize the time series in order to forecast the data using the past values. A time series is the sequence of a variable's value over equally spaced periods, such as years or quarters in the business applications and similarly in the healthcare industry. Single moving average methods utilize smaller and smaller numbered sets of past data to decrease the error that is associated with taking a single average, making it a more accurate average than it would be to take the average of the entire data set. So centered moving average as the median numbered data set is difficult to calculate with even numbered data sets. So this method works better with odd number datasets than even, which is the centered moving average. So predictive modeling, here we are to deal with the regression analysis, and out of the regression analysis, the choice would be with us for the linear regression. In this case, a plot is constructed with the previous values of the dependent variable plotted on the y-axis and independent variables that is being analyzed plotted on the x-axis. A regression line is then constructed by a statistical program representing the relationship between the independent and dependent variables, which can be used to predict the values of the dependent variable. So regardless of the values used in general, the process of creating predictive models involves the same steps. First, it is necessary to determine the project objectives and desired outcomes and translate these into predictive analytic objectives and tests. Then, analyze the source data to determine the most appropriate data and model building approach. Models are only as useful as the applicable data used to build them. Select and transform the data in order to create the models. So, what is all of this model usage in the healthcare industry? Artificial intelligence in healthcare is the application of artificial intelligence to analyze and understand the complex medical and healthcare data. In some cases, it can exceed or augment human capabilities by providing better or faster ways to diagnose, treat, or prevent disease. So, what are the clinical implications or applications for all of these scenarios? Artificial intelligence can show promising results in accurately diagnosing and risk stratifying the patients with concerns for the coronary artery diseases, showing potential as an initial triage tool. So, AI can assist doctors treating ulcerative colitis in detecting the microscopic activity of the disease in people and predicting when flare ups will happen. For example, an AI-powered tool was developed to analyze digitized bowel samples or biopsies. The tool was able to distinguish with 80% accuracy between samples that show remission of colitis and those with active disease. It also predicted the risk of a flare-up happening with the same accuracy. So it can predict the future as well. So, artificial intelligence utilizes massive amounts of data to help with predicting illness prevention and diagnosis as well as patient monitoring. In obstetrics, artificial intelligence is used in the magnetic resonance imaging, ultrasound, and fetal cardiotocography. AI contributes in the resolution of a variety of obstetrical diagnostic issues. AI has shown potential in both the laboratory and clinical spheres of infectious disease medicine during the COVID-19 pandemic. AI has been used for early detection, tracking virus spread, and analyzing the virus behavior, among the other things which were done during the COVID-19 pandemic. Other applications of AI around infectious diseases include support vector machines, identifying antimicrobial resistance, machine learning analysis of blood smears to detect malaria, and improved point of care testing of Lyme disease based on antigen detection. Additionally, AI has been investigated for improving diagnosis of meningitis, sepsis, and tuberculosis, as well as it can predict the treatment complications in hepatitis B and hepatitis C patients. So researchers have conducted a thorough study using a machine learning algorithm to show that standard radiographic measures of severity overlook objective but undiagnosed features that disproportionately affect diagnosis and management of underserved populations with the Nipah. They propose that new algorithmic measure ALGP could potentially I'm sorry could potentially enable expanded access to treatments for underserved patients. Future initiatives AI has been explored for use in cancer diagnosis, risk stratification, molecular characterization of tumors, and cancer drug discovery. A particular challenge in oncologic care that AI is being developed to address is the ability to accurately predict which treatment protocols will be best suited for each patient based on their individual genetic, molecular, and tumor based characteristics. Generative adversarial networks are a form of deep learning that have also performed well in diagnosing Alzheimer's disease. There have also been efforts to develop machine learning models into forecasting tools that can predict the prognosis of patients with Alzheimer's disease. Forecasting the patient outcomes through generative models has been proposed by researchers as a means of synthesizing training and validation sets. So this is an important trick where you can find some of the quiz on the same topic. Here you will come across the population attributable risk percentages and population attributable risk and attributable risks and their associated important questions. Coming on to our recent advances, this is an journal article which is being published in the PubMed. It's a method for using epidemiologic data to estimate the potential impact of an intervention on the health status of a target population. So, as per the abstract, it says a general method is proposed for estimating the potential impact of a prevention program involving risk factor modification on the incidence of specific diseases in a target population. An evaluative framework for comparing alternative intervention strategies is also presented. On the basis of the results from epidemiologic studies, a user must specify certain parameters regarding the distribution of the risk factor that is to be modified in the population. The magnitude of the association between the risk factor and disease and the total risk of disease in that population. A quantitative measure called the potential impact fraction is derived to estimate the proportion of expected new cases that may be prevented under intervention programs of varying successes. So estimates of this measure are then used to assess the potential efficacy, effectiveness, adequacy, and efficiency of planned intervention strategies. The method is illustrated with published data relating relative weight and coronary disease among middle-aged US men. So this is a book chapter which says more on risk estimating the potential for a prevention. The concept of attributable risk. That's attributable to selected risk factors or risk factor classes in 2010 worldwide. In this particular study, smoking and coronary heart disease a relationship was studied, which was a hypothetical cohort study of 3,000 cigarette smokers and 5,000 non-cigarette smokers. Estimating the potential impact of behavioral public health interventions nationally while maintaining agreement with global patterns on relative risks. So, this paper introduces a novel method to evaluate the local impact of behavioral scenarios on disease prevalence and burden with representative individual level data while ensuring that the model is in agreement with the qualitative patterns of global relative risk estimates. So what was the method used here? The disease-specific hierarchical base model estimate the individual disease probability as a function of behaviors, demographics, socioeconomics, and other controls. where constraints are specified based on the global relative risk estimates. The simulator combines the counter factual disease probability estimates with disability adjusted life years, which are daily per prevalent case estimates, and rolls up to the targeted population level, thus reflecting the local joint distribution of exposure. So this is an important another link, which is the robust variance estimation, where you can find an very important and knowledgeable video to be shared with. This is time for our MCQs and key takeaways session. So MCQ number 1. If a health department identifies that 80% of new type 2 diabetes cases in the region are associated with modifiable risk factors such as obesity and sedentary lifestyle. So, what is the most appropriate next step in estimating the potential for prevention in this population? A. Implement a mass screening program. B. Calculate the population attributable risk. Launch a public awareness campaign, identify the genetic causes of diabetes, or E, calculate the odds ratio for that very population.
Beta, B.
Yes, the answer is beta or B. MCQ number 2. A hospital quality team notices a high rate of post-operative infections in one of its surgical wards. Which action best applies the concept of estimating the potential for prevention? Replacing all surgical staff, reviewing past infection cases to identify preventable factors, increasing antibiotic usage for all patients, isolating patients post-surgery, or just wait and watch till patient is getting discharged or comes to a halt for the infection.
Beta.
Beta. Exactly. Beta is the right answer because reviewing the past infection cases to identify the potentially preventable factors to be plotted for the future interventions. MCQ number 3. In a city, 60% of motor vehicle deaths involve alcohol impaired driving. So estimate how much of the mortality burden is preventable, which measure should be applied. Case fatality rate, relative risk, population attributable risk, attributable fraction, or standardized mortality ratio, or attributable risk simple.
E.
Okay. Answer is C, population attributable fraction. Attributable risk basically is being done in a population where there is a more prevalence and there is a significant cause related and already being identified as a risk factor identified. So population attributable fraction is when a single cause is not identified and mostly not impacting the whole of the population. So 60% of motor vehicle deaths involve alcohol impaired driving. Other factors or risk factors are also being identified. So population attributable fraction is the most suitable answer. MCQ number 4. A researcher finds that a vaccination program reduced disease incidence by 40%. How can this data be used to estimate the potential for prevention? Predict the disease trends without any intervention, estimate effectiveness of future screening tools, quantify preventable cases in unvaccinated populations, assess treatment efficacy post-infection, or try the MDR regimes in all of the cases in which the vaccination program is being done. Vaccination program has reduced the disease incidence by 40%. So potential for prevention can be basically
Charlie.
Charlie, quantify preventable cases in unvaccinated populations. Quantification means you are going to go through the preventable cases which are either not MDR, XDRs, or they are in the unvaccinated population. So MCQ number 5, a country aims to reduce cardiovascular risk. 70% of the risk factors are linked to unhealthy diet and smoking. Which intervention planning approach best reflects estimating the potential for prevention? Identify the most lethal type of cardiovascular disease. Measure the outcomes in patients already treated. Quantify burden avoidable through lifestyle changes. Focus on developing more surgical treatments, or introduce salt-free diet and collect the data afterwards.
C. Charlie.
Yeah, C is the answer. Quantify the burden which is avoidable through the lifestyle changes, which is a major modifiable risk factor. MCQ number 6, an NGO is working in a region where childhood diarrheal diseases are common. They plan to introduce clean water and sanitation. What should they apply, or how should they apply the concept of potential for prevention before implementing their intervention? Test all children for infection, estimate disease burden linked to water contamination, begin vaccination campaigns against all diseases, offer antibiotics to all symptomatic children, take a pre-vaccination and post-vaccination test protocol.
Beta.
Beta.
Yeah, answer is beta. Estimate the disease burden which is linked to water contamination alone. MCQ number 7, a public health analyst wants to justify a budget for injury prevention in construction workers. Which step best demonstrates applying the concept of estimating prevention potential? Analyze National Trauma Center data only, estimate injury cases preventable through safety protocols, interview workers about their job satisfaction, assess the cost of treatment for each injury, or use of the personal protective equipment practices.
Beta.
Yes, answer is beta. Estimate the injury cases which are preventable through the safety protocols commonly practiced. Not only the PPEs, but other safety protocols which involve the machine safety tools and others, etc. MCQ number 8, a community program claims it can reduce teen smoking rates by 30%, which data would help estimate the population level prevention potential. Number of teens who dislike tobacco ads, number of teens currently smoking in the population, number of stores selling the cigarettes, number of teens with lung cancer, teens having access to TV commercials. Which data would help estimate
Beta.
the population?
Beta.
The answer is beta. Number of teens which are currently smoking in the population are basically the target population to which we are going to devise other. So MCQ number 9, researchers are studying the obesity trends in adolescents. They find that increasing physical activity alone can reduce obesity by 25%. To apply this information, what should they estimate next? The caloric intake of each adolescent, the number of adolescents which are at genetic risk, the percentage of obese adolescents who are inactive, the cost of gym memberships, which is restraining them from having an active life, level of sedentary lifestyle.
C. Charlie.
Answer is C, the percentage of obese adolescents who are inactive. So MCQ number 10, a city health office wants to reduce asthma-related ER visits. It notes that 40% are due to poor air quality. Which approach best estimates the potential for prevention? Measure average air quality over 5 years, predict future asthma rates if pollution increases, calculate the ER visits preventable by improving air quality, increase asthma medication dosages, pollen exposure rates in the susceptible population.
Beta.
Yes, basically,
Charlie.
Charlie related ER visits, which notes that 40% are due to poor air quality. So we have to calculate the ER daily visits or increase, which are preventable by improving the air quality. That's the key for our MCQs. This is a note of thanks to all of you who had been with us and showing your responses and giving us support tremendously. This is the link to our YouTube channel where you can find all of the educational videos and contents. And at the end, I would like to end this meeting for all of us.
Thank you, Fatima. Nice lecture.